Hi, back again with summer appearance video recording. So the question that we're addressing this week are discuss some of the purposes of using tests in the process of assessing and diagnosing clients. So the purpose of assessments in regards to using tests is that there's an accurate evaluation that is conducted to yield the results needed to diagnose and treat clients. So we need these so that we can properly diagnose and guide treatment accordingly. They'll also give us additional information to aid in our results. We have to make sure that they're reliable and valid, like we learned last week. They're used for a lot of reasons. So some examples would be children with aptitude testing in an educational setting. Those kids may be needing to undergo testing for special education services, so we'll use assessment tools for that. Some of the ones that I've used this past year have been like career assessments, which is really good for trying to evaluate what someone's interests are for their career. Some of the other ones would be like psychological testing for like anger, depression, anxiety, things like that. So all assessment tools are important in regards to diagnosing and treating, and to assess them properly, to have an accurate diagnosis is the pro for this. So proper testing yields proper diagnosing, which is resulting in proper treatment. So some of the cons of it, our textbook and the supplemental reading talked a lot about test taker bias. So some of examples of this would be anxiety, motivation, language barriers, cultural differences. Selection bias is another one that I've found. This is when a test's predictive ability varies by group. And then like content bias too. If content favors one group over another, interpretation of test items due to various cultures, understanding them differently. And let's see, what else? Individuals with disabilities. Okay, so disabilities would be a factor as well. Communication disorders, intellectual disabilities, visual and hearing impairments, religion, spirituality, race, sexual orientation, can't talk today, and socioeconomic status. So this could be a lot of cons. These could be a lot of factors that could contribute to some unfair testing or some inaccurate results for assessments. So the examiner really needs to be aware, because there's examiner bias as well. They just need to be really aware of the group that they have that they're assessing, the differences, their emotional state, what culture they are, what race they are, what gender they are. They just really need to keep all those factors in mind when giving assessments so that you can receive the proper results to diagnose and guide treatment.